Hello, my name is Joshua Mugabi. Welcome you to topic 10.3. We are looking at sexual reproduction in humans. And we are looking at learning outcome D. Understand aspects of care for the baby after birth. Breastfeeding, balanced diet, immunization, and hygiene. We are going to look at learning activity. In groups, learners search, brainstorm, and report on care for the baby after birth, breastfeeding, balanced diet, immunization, and hygiene. Care for the baby. Item 1. We are going to emphasize on breastfeeding. During human biology lesson, the teacher introduces the topic postnatal care of the baby, on how to care for a baby immediately after birth and during early childhood. Tasks. What is the importance of breastfeeding? We want to look at the importance of breastfeeding. Now, breast milk is the best food for a baby. Exclusive breastfeeding for the first 6 months is recommended. It provides nutrients, water, and antibodies for immunity. Breast milk is the best food for a baby. Proper positioning and attachment are important to avoid breast problems. So you can see the mother here is being directed how to position the baby. And this one is very important because it brings attachment and it also avoids breast problems. When and how complementary feeding is introduced. When and how should we introduce complementary feeding in the baby's diet? The balanced diet after 6 months, we should incorporate in what we are referring to as complementary feeding. So after 6 months, babies need additional foods while continuing breastfeeding and many others. You can introduce different food. For example, we can see here 0 to 4 months, we are having breastfeeding. Then at the 4th month, you can introduce some banana mash. 5th month, you can introduce in some little fresh. You can introduce in the eggs, 7 months, vegetables, mashed, purples can come in, carrots and so on, squeezed and so on, within the 10th and the 12th month. Then, a balanced diet should include carbohydrates, proteins, fats, vitamins, minerals, and also clean water. So those ones should be introduced after the 6th month, what we are referring to as complementary feeding. Also, suitable foods can include porridge, mashed vegetables, fruits, eggs, mashed beans, potatoes, among others. Why is immunization necessary? Let us first look at the chart of immunization here. The age of the child, the dose, and the type of immunization. When the child is 2 months, first dose is given. And this type of immunization we have DPT, hepatitis B, hib, polio, and pneumococcal. Then on the 4th month, that is the second dose. DPT, hepatitis B, hib, polio, and pneumococcal. When the child is the age of 6 months, we take the child for the 3rd dose. Still DPT, stroke hepatitis B, stroke hib, polio, and pneumococcal. When the child turns 12 months of age, we take her for the 1st dose of yellow fever, measles, mumps, and rubella. When the child turns 18 months, we take her for a booster. This is the 4th dose of DPT, polio, and pneumococcal. When the child is 2 years, we take her for the booster dose, the 2nd, for measles, mumps, and rubella. Then age 4 to age 5, we give them the booster dose, the 5th dose for DPT and polio. So we go back to our question. Why is immunization necessary? Immunization protects the baby from killer diseases such as polio, measles, TB, whooping cough, hepatitis B, and pneumonia. Secondly, babies must follow the Uganda Routine Immunization Schedule, RI. The vaccine stimulates immunity and reduces infant mortality. Now let us look at general baby care. What is the importance of keeping the baby clean and in a safe environment? What is the importance of keeping the baby clean and in a safe environment? So, after seeing that, what is the importance of keeping the baby clean and in a safe environment? Hygiene and general body care. The babies must be bathed with clean water and kept warm. The feeding utensils and clothes should be kept clean. The diapers should be changed regularly to prevent infections. Baby's sleeping area should be safe and free from hazards. Hands must be washed before handling the baby or food. Summary. Proper care of a baby after birth include exclusive breastfeeding for the first 6 months, providing a balanced diet after 6 months, ensuring immunization to protect against common child diseases, and maintaining high standards of hygiene. These practices promote healthy growth, prevent infections, and reduce infant mortality. Brainstorming and discussion. In this case, when you are brainstorming and discussing, you should include or discuss exclusively breastfeeding for the first 6 months. You should discuss about the types of food that make a balanced diet for a growing baby. You must talk about Uganda's routine immunization program, and then the importance of keeping the baby clean and in the safe environment. Thank you very much for participating in topic 10.3, sexual reproduction in humans. We have been looking at learning outcome G. Understand the aspect of care for the baby after birth. That is breastfeeding, balanced diet, immunization, and hygiene. Our learning activity has been in groups, learners research, brainstorm, and report on care for the baby after birth, breastfeeding, balanced diet, immunization, and hygiene. Please visit me at Mugabi Joshua Biology on YouTube. Don't forget to like, to share, and subscribe.